Hi, mate.
Hi there.
Adam,
Hi,
nice to meet you.
Dom, nice to meet you too. It's a bit brisk out there, isn't it? Oh, another one.
Hello.
Hi there.
Stand on deck. Hello.
How you doing, Dom?
Shaheed.
Nice to meet you.
Hi, nice to meet
Hi,
you.
Shaheed, how are you?
It's a bit of a tight squeeze.
It is a bit.
That's alright.
Morning, chaps.
Morning.
Hi.
And what do you do for a living?
Work in pharmaceutical marketing.
Well, I've got to say that sounds as boring as my job. Going round and round in circles all day.
Some say it is boring. I think a lot of people who come into the industry definitely think that there is a side of pharmaceutical marketing that is boring, but there is a huge amount of potential in terms of the talent that it attracts, and also the quality of work that is represented at things like Cannes Lions Health. So I think it's definitely changing. There's a shift in the perception of pharmaceutical marketing, at least agency side. I can't speak for clients.
Yeah, I think there's a shift, but I still think there's a bit of an old school mentality in terms of how marketing is done.
Yeah.
And I think it's largely based on, you know, in the early days you had these large primary care products that kind of sold themselves, and they had a large patient population. So and also the regulations were different then, so they had large sales forces. Whereas now, especially in my company, it's much more targeted.
Yeah.
So you need to think of, I guess, the brand more than just the product, and how you support the patient and the delivery of medicine as well. So, but in terms of the individuals within marketing in a pharma company, I think the fun stuff is generally outsourced to you guys. Generally.
So the
creative,
agencies get all the cool stuff.
Generally speaking, that's mine.
Do you think that's because there's always been this over-reliance on the field force, and that most of the actual selling is done by the people involved rather than actually the marketing collateral?
Yeah, I think that's fair, and I still think even with the new specialised medicines, you still need a high-quality sales force.
Yeah.
But I just think access and just reaching customers is changing, and also, I mean, my father is a doctor, right, and my father uses the internet regularly and he uses iPads, but there's still kind of thought process that a lot of doctors don't like that kind of medium of communication, whereas I don't think that's necessarily true, and there's a lot of young innovative physicians who want to be contacted through different communication channels. That's why multi-channel is becoming more important, but we are behind some way.
When you say behind, do you think we're behind when you compare us to things like consumer, FMCG, retail marketing, the big brands that we see on the high street?
Yeah, I think so. I mean, I think, if you think of a non-pharma industry, they can go direct to their person who uses their product. A lot of the time the product they're selling, people want it.
Yeah.
When you're sick, you don't want medicine.
Yeah.
So how you create a connection and a brand with those patients is actually quite tricky.
So whose responsibility is it to not make it boring? Do you think it's the pharmaceutical industries themselves, people like yourselves, the marketers, or do you think it's more the agencies, people like us?
I think it's a bit of both.
Right.
I think we need to work with different types of agencies. So there's kind of a tendency to work with your ones you've always known about for a long time, and a lot of those agencies specialise in face-to-face type content and communication. Whereas I think if we really want to get to know our patients and we really get to know our customers in different ways of communicating, then we do need to leverage partners better.
Yeah.
I also think working with startups and innovators in the space will change perception. Yeah. I think, which is quite interesting.
And I guess our world is changing as well as agencies. We're having to flex and be different to what we were even 5 years ago in the way we talk.
I think the question's really interesting, right? It's why is pharma so boring? Because there is this perception when you compare it to the fancy world, the consumer world, it does feel boring. But I think certainly in my experience over the last sort of 7 to 8 years, I think pharma, from a creative perspective, has actually gone leaps and bounds. It's a talent issue as far as I'm concerned. I mean, I've come from consumer side, and I can tell you from real life experience where you'd always gravitate towards the charity ads because they just felt like they meant a little bit more than selling, buy one get one free on potatoes this week at Sainsbury's. And I think that what the pharma industry is going through right now, because it's been a bit like Hogwarts, it's been massive but invisible. You know, people don't necessarily come out of creative arts schools or colleges thinking, you know, I'm not going to go and work for Nike, I'm going to go and work for some pile cream product or whatever happens to be. But now you've got a little bit more exposure to that talent. That talent's now kind of going, hey, that's really interesting. I'd quite like to work on HIV.
And it's interesting when I work with agencies and I go into agencies, the young, talented developers actually really like working in healthcare because they feel like they get more out of it, which is really nice.
Yeah.
And I think you're right. I think pharma are employing different types of people with different types of capabilities, not just in commercial settings. So we talked about marketing being boring. You know, clinical in many respects has been done in the same way for a long period of time, whereas now that whole space is innovating as well. It's a bit like you look at all the different industries like banking and travel and everything else, and it's been disrupted. Now is the time healthcare is being disrupted. The only slight concern I sometimes have is a pharma disrupting as quickly as healthcare. So, you know, one day healthcare might be, you know, down here and we're still just, you know, manufacturing the medicine, whereas actually I think there's definitely an ambition to deliver a service as well as a medicine, which is nice, which means you then have to be more creative, you need to be more brand focused and work with the likes of you guys on content. Right?
It's a really good point as well about healthcare versus pharma as well. But the quality of the work that you see in health and wellness just seems to be better than a lot of the work that you're seeing within the pharma space.
Yes and no, I'd say it's slicker in terms of the way they present, the way that they've changed the world, as every can entry seems to do, even though you've never seen it before. And I think if you just go to the ideas and stuff that still wins at pharma awards, like the good ones, I'm not talking about the shit ones now, but the good ones, at the heart of them, there's still some fantastic ideas. The rise of agencies at the moment, you know, 7-8 years ago, I think Langland were probably the start of it. And why were they the start of it? Because they managed to get in consumer type of thinking into those agencies, not on just a creative level, from planning, from suits, from everything. And then all of a sudden, it was like a sneeze. Loads of little agencies now starting to pop up, and the work that they're producing today is like a different agency compared to where they were before. And the only way our industry is going to get better is if they keep fracking into that extra talent and that diversity pipeline. And I truly, truly believe that in the next 10 years, if we can keep that pipeline in and keep inspiring like people in terms of the type of work that we can do for the world, as cheesy as that sounds, we will be the most creative industry within the field of communications, I believe.
I mean, I'd like to believe that. I think it's noble. I guess for me, I would like the ambition to be that healthcare marketing, pharmaceutical marketing, is on a level with that which you see in the consumer world as well.
I think you're right. I think we've made leaps and bounds on the content we create and working with you guys and everything else. But in terms of that connected experience you give, whether it's a physician, a nurse, a patient, I think that sophistication, and that's the difference between so core marketing, like the promotional part of marketing. I think, yes, we have the content and the assets, and yes, we have the ambition and some of the talent's changing, but do we actually have that kind of way of integrating a campaign to create an experience that's differentiated and therefore resonates in the mind of the person you want to change the behaviour, right? Because you want to change them from thinking one thing to another, right?
Yeah.
You do that through an emotive or an interesting brand. And at the moment, you know, they're seen as products, they're not seen as brands, and I think even though we're getting better to get to where you want to go to, we need to create those connected experience more effectively.
You know, even if you look at things on a micro level, right? So there was this one thing that I saw last, it was done by Area 23. Now this didn't win anything at Cannes, right? But I thought it was the best thing I'd seen all year. It was amazing, right? It was for a symposium for some diabetologists in the States. They'd booked this hotel out, and you'd had like a bunch of diabetologists coming up, and they had like a hidden camera and somebody counting like how many people took the steps or how many people took the escalators. And they walked into the room and there was like a plate of cake and a plate of fruit, and they were clocking who was taking what. So before they've, you know, started this 500 PowerPoint slide meeting for these guys, they're like, right, so you've all had like 2 lifestyle choices today, both healthy, both unhealthy. 70% of you took the escalator and 80% of you took the cakes. Discuss.
Yeah.
That's a memorable experience, right? What does success look like for any symposia? get them charged, get them ready, get them feel like they're part of this conversation, get them to feel like at the end of it they're going to make some really great decisions. That only comes from getting the best talent into your agencies. And the best talent, you know, again, 6-7 years ago, we're not thinking I'm going to go into healthcare. Today, it's that fracking wherever these people live is starting to happen with little agencies. One observation that I've made, because I couldn't quite work out why healthcare creatively was so behind, I couldn't figure it out. Because you've got the best briefs, you've got the best products, and the channels, fine, they're a little bit more hidden than, you know, say Nike or Adidas or whatever, but it doesn't stop you from creating those experiences for people. So why is it so bad? My experience is that you've had a lot of agencies for a long time who've just sort of like not got the right talent in. So people have pretty much, and I do apologise if this offends anyone, but you've had a lot of people who started off as art workers, right, in a creative department.
Yeah.
2 years later, there's a job for a designer. Now this art worker goes, I know where the logos live on the server. I'm a designer. All right, you're a designer now. 1 year later, I'm a creative director now, I know where the logos live. And you've got these people who are just producing absolute nonsense for like 20 odd years, saying I've won 500 awards in my career because the industry sort of set up these infrastructure award shows to award this nonsense. And so for so many agencies, you're kind of going, well, no wonder it's all so shit. Like, no wonder.
Okay.
And so,
it also makes it a challenge for pharma then to pick
Absolutely.
the right partners.
Absolutely.
And so what a lot of the time is, you know, and it's similar actually in pharma, because a lot of the marketing people aren't necessarily marketing from trade, right? They come from sales, they carry the bag, and there is this kind of, you know, process that you would normally follow to get into marketing. And don't get me wrong, there's a lot of really, really great marketers in pharmaceutical companies, but then the question you all talk about is how do you get the right talent to improve how we do marketing, and I think that's a challenge for pharma too, because there's almost too many now. And you know, we're actually, the creative elements of pharma now looking at those subcontractors that big agencies use as well. But then, you know, how do you pick the right agency? How do you identify the right partner? And it's a bit of a kind of trial and error, and there's a bit of trust and everything else. But I think that is tricky. So what you've just told me is slightly worrying. But
But it is echoed on both sides, isn't it? To that point, is that you know, you've got the traditional from a creative side of an agency, not necessarily followed through on the accounts or planning side, on the more strategic side, where you do go through a rite of passage to become a creative director, which isn't always the right way. Similarly, on the pharmaceutical side, you carry the bag, you don't earn your stripes, you become brilliant at selling, and so therefore you must be good at marketing. Not always translates as being the same thing. So there's this kind of simpatico, if you like, where we need to be much better on both sides, and maybe look at the evolution of our people to getting to the right positions and giving them the right training. I think though that to the original question of whether it's boring or not and how maybe we make it better, there has to be an owned responsibility on both sides, because I think a lot of the time the best creative work doesn't come purely from the agency, it's from the brave client, it's from the client who wishes to do better creative work to affect or elicit a behaviour change, not just to have some great vanity project that they can put in their portfolio to get their next promotion, but because it actually does something that actually affects a change. The myth of pharma marketing being boring has been debunked. Hopefully we've debunked it a bit in the course of this conversation, but I think definitely 7 years ago, maybe even less, it was quite a boring industry to work in. I came from consumer world, and I definitely thought, what the hell have I done moving into healthcare? But in the last couple of years, it's become far more exciting, far more interesting, and I think the people we're getting to work with, both within agency and within client side, has become more interesting as well.
Yeah. Is pharmaceutical marketing boring? I think it's challenging. I don't think it's boring.
There we are, gentlemen.
Oh, thanks very much. Thanks for the lift.
Oh, there's a fire over there, Dom. I've got to go put it out.
Okay, cheers.
I've got to catch a train, Dom.
Well, yeah, sure.
Nice to meet you. Nice to meet you.
Enjoy
Give me a call.
Yeah, appreciate. So, so I'm going to pay then. Yeah.
You're the lucky one.
Big networked agency doesn't pay. Client doesn't pay. Smaller agency pays. Yeah, typically.
Then what?
Yeah. Okay.